talk about delayed recovery syndrome, part of my contribution to the overall interdisciplinary team approach is number one, recognizing that chronic pain is a multifaceted, multidimensional medical condition, as is true of other things like cardiac disease or cancer-related issues. There's the physical side, there's the personal or the psychological side, there's the situational side. And we know that people do best when we address all of these different dimensions simultaneously. And so part of what pain psychology services can really contribute to a person's medical, surgical, or rehabilitation efforts and recoveries is identifying some of those psychological barriers that actually get in the way of people's responsivity to those treatment approaches. And that's why when we talk about something like medication in particular, to be able to address some of the personal sides of what people are going through, especially with something like stress, which we know can intensify the sensory experience of pain. If we're looking to treat pain only from the pharmacological side, the medications can only do so much. And where people struggle is with the psychological side of what they're going through is not going to be adequately addressed by the opioids. And to help people address some of the anxieties or depressions, oddly enough, help them then put their reliance upon medications in a much more proper perspective. And in essence, they get much better outcomes because now the medications are really covering what they need to cover, where in many cases, when you don't include something like pain psychology services, part of what's contributing to people's physical sensation of pain is really the unaddressed psychological drivers of that pain that these medications were not cut out to cover. If you would like to set up an appointment, please call me at the number below.